Welcome to Offscript. Tune in every week to hear the stories of and insights from NPs. We're your hosts, Maxine and Danielle, two technologists who are passionate about the future of patient care.
Our guest today is Dr. John Barrett. Dr. John Barrett is an emergency medicine nurse practitioner, a scholar, and an educator at the University of Pennsylvania. In today's conversation, we discuss Dr. Barrett's career path, his day-to-day as an NP, his experience as an ultrasound scholar, and much more. Dr. Barrett, thank you so much for being here. Could you please give us your own brief intro?
Oh, yeah. My name's John Barrett. I'm a nurse practitioner. I work in the emergency department at Penn Medicine. I also teach at the School of Nursing, and I have kind of a love for ultrasound. And so that's taken my career in kind of a different path, which has been exciting and challenging at the same time.
Well, thank you so much for being here today. We'd love to start by learning a bit more about what brought you into nursing and how your career has evolved. So, maybe to start, how did you decide to transition from family and sports medicine into emergency medicine?
Oh, yeah. So before I was a nurse practitioner, I worked in emergency medicine as an emergency medicine technician, and I was a firefighter. So I was a career firefighter for 14 years. And I had thought at that time that I really wanted to get out of the emergency medicine kind of care model where I would see patients for a small amount of time, treat them, and then the rest of the team would take care of them. And so that's why I transitioned to family practice. And ultimately, family practice, this dream I had of the way family practice was, ultimately ended up being long, long hours for me. And that challenging dynamic where I didn't have the freedom to expand my career because of how busy I was made it hard for me to continue that path. And so then it just kind of evolved down. I kind of was against it. I was really against going back to the emergency medicine side of things. And some of my friends had to really convince me to give it a shot. And I did. And then, of course, I fell back in love with it because it's where I've been for so many years.
It makes a lot of sense and is challenging when your day is so full that then you can't continue to enrich and learn and all of that.
Yeah.
So it makes sense as a reason to transition. How did you fall back in love with it? What did that process feel like?
I came in and got to see patients at the bedside, and I'm fortunate that in my organization, they allow us to focus on quality of care. And so I have the ability to really make an impact on my patients in ways that I might not have in other less resourced areas. And I felt good about the care that I was giving. And as opposed to in family practice, I felt like my time was always short. I never had enough time to spend with the patients. And because of that, I felt like I was seeing so many patients and not being able to care for them in the way that I really wanted to. Or for me to be able to care for them the way that I wanted to, I had to spend really long days. So I would end up spending, 12 hours in the clinic instead of what I would hope to be would be an 8-hour day.
Seeing patients at that volume and at that length is so challenging. I guess more broadly, along your path, were there any significant challenges or formative moments that you feel like shaped your career?
Oh gosh, I think there's all these formative moments in someone's life that like change the trajectory. Like people ask me, what would you think your life would be at in 5 years? And if I go back 5 years ago, I would not expect to be where I'm at today and 5 years before that. And so there's all these different moments. The moment I decided to leave the fire service, a very stable career with a very nice pension, to try something different and go back to school and pay money to do that, that was a pretty formative decision. And going to school at Duke and Penn, opened up a lot of doors for me. And then taking on those jobs in family medicine, that allowed me to have a really good clinical base and understanding of how to treat different clinical conditions. And the people that we saw in our clinic had a lot of very complex medical conditions, which gave me some more confidence when I moved into the emergency department. So I think it's just these moments of time, and it can be just meeting someone. My advisor at the School of Nursing turned out to be a mentor for me, and same for the person who introduced me to ultrasound is now a mentor for me. And so those people have made a real difference in my life, and those are like these moments that I remember.
That's wonderful. And it really does seem like you've had so many careers in a short period of time and you've made so many really meaningful transitions. You mentioned a bit about some of the mentors that have helped to guide your journey, but would love to hear a bit more about them and how they've helped shape your decisions to date.
I think this is true for most people, is that when you find someone that really cares about you and your like success and your well-being, that they make an impact on my life. And those people was my advisor down at Duke was one of those people. And I met that person by chance, actually, when I was interviewing for the School of Nursing. We were supposed to eat lunch with all the other students that were interviewing. And I saw that, all the lunch tables or the tables where people were sitting were full. And so I sat down with some of the faculty. And that one chance where we had lunch that time kind of opened up a relationship where she guided me through my path, actually guided me away from Duke to go to Penn for nursing for my nurse practitioner degree. And it has since kind of been that person that I can reach out to when I have questions in the faculty side of things, or where do I think my next step in my career would be. That really is pretty special. And then Nova Piambianco, Dr. Piambianco, who opened the door for ultrasound for me, is equally that person. So, she's the person that calls me and asks me how I'm doing when I'm having a bad day, and she knows it, right? And that someone to have that level of caring about you and what you're doing and how well you're doing, on top of she's an amazing clinician and she's able to teach me things that make me be able to care for patients better. So like those two relationships, they're the relationships that have stood out in my career as a nurse practitioner that have taken me, for the last 10 years to where I'm at today. It's pretty cool.
Definitely, those relationships both sound really special and so serendipitous how they ended up manifesting. And it seems like you've done a really good job of putting yourself in situations to get lucky and then taking advantage of the luck that comes there. So that makes a lot of sense. We know that you've also served as a mentor to many others in various capacities. Would love to hear a bit more about a mistake that you maybe made during your career that you'd want some others to avoid.
Yeah, I think the biggest mistake I made, and I guess I would argue sometimes I still make that mistake, is that I don't take enough time to care for myself, to take, to realize what my true value is and advocate for that on my behalf. When I started in my job as a nurse practitioner, that meant long hours away from my friends and family and working out and those types of things. And if I could do it all over again, I think I would spend less time on that and more time on the things that kept me healthy, my sleep, my exercise, and things like that.
There is no substitution for self care in terms of being able to make progress and feeling good about doing it the whole time. I think that's advice that lots of folks who are really ambitious probably need to hear. And so appreciate that. Now that you have this additional perspective and more years in your career under your belt, how do you see your career continuing to grow and evolve? I know you mentioned the last 5 years, you couldn't have predicted that, and the same with the 5 years before. But I guess we'll still ask, what do you think the next 5 years might hold for you?
I have no clue, right? Like, I really honestly don't know what will be in store, right? I wouldn't have thought about doing ultrasound if it wasn't for Dr. Piambianco pulling me into a room in the middle of the pandemic and saying, "Do you want to see this tool?" And I was just amazed that she could diagnose someone with a DVT at the bedside, and that I just thought to myself, wow, like this takes me hours to diagnose because I have to call a radiology technician, technologist to do a scan, and it has to be read by the radiologist. And to be able to do that at the bedside and make clinical decisions is just like was amazing to me. And then she just happened to also like want to help me learn and start teaching this to the nurse practitioners and PAs that we work with. And it kind of flowered from there and blossomed. I would never have expected, like if you would have asked me even a month before that meeting, do you think you'll ever do something like point of care ultrasound and go into this kind of specialized field within emergency medicine? I would have never guessed it. The thing that I try my best to do is say yes or be open to opportunities for change, and then follow those paths when they seem like they're the right fit, and then saying no to the things that don't seem like they fit my values and my goals or where I want to be.
It's amazing how open you are to opportunities, and you're certainly very measured, but also very flexible and just willing to explore new ideas and follow your curiosity, which is a really good way to think about career steps. We'd love to also learn a bit more about your role today because we know it's unique in a bunch of different ways. What has your experience as an ultrasound scholar been like so far? What does the role entail? And just tell us a bit more about what that looks like.
Yeah, so I'm in a 1 year program that mirrors some of the guidelines for fellowships that some of our physician colleagues do in point of care ultrasound on the emergency medicine side of things. And so what my day to day looks like is that I have less clinical responsibility. So I see less patients or less clinical shifts. And during that time, some of that's substituted for didactic hours doing what we call conference, QAing or quality assuring scans. So today is the day that I do quality assurance for our health system in the ER. And so I have to review every single ultrasound that's been done in the ERs and make sure that the clinical question was answered, that they're filling out worksheets appropriately, and giving feedback to people that are doing the scan so that they can improve themselves. And then the other part of that is research. And so that's developing some type of research that we're working on. And I have a couple things going right now that I think we'll wait till we get published on them before we talk about it. But some of the areas of research that might change clinical management or care, or even on the education side. And then I spend a day a week in the emergency department or somewhere else in the health system doing scans. So I'm practicing scans, learning more advanced techniques, and then teaching others how to do the scans at the same time. So that's what my day-to-day looks like. And it's a little bit different than when I was just working clinically. I would work 3 12-hour shifts a week in the ER and see patients clinically, and then go home and take note of my work home.
It does sound very different from that setup. And like you're juggling lots of different roles or lots of different frames of thinking in order to do your work. So it sounds like you now are bringing your work home with you. What does that look like today?
Well, I don't bring my clinical work home with me, with some rare exception. If there's something that I feel important about, like I want to reach out to some patient about a result later on in the evening and I've left, I might do that. But I don't bring my work home like I did in family medicine. But I do bring work home. So like right now I'm working on a textbook chapter. And so tonight when I get off of this podcast, I'm going to be working on that chapter. Or, I might be studying for the conference that we have coming up or things like that. So my day-to-day just kind of varies. It's one of the reasons I went into emergency medicine, because in the emergency medicine side of things, I don't work as many days in the week. So I work normally 3 days a week. And it gives me the opportunity to do different things, explore different opportunities. And so it's one of the reasons I like, is because my day to day is a little bit varied when I'm outside of the clinical aspect.
Yeah, absolutely. As you are bringing some of that work home, though, that I guess non clinical work home, do you have any tips for continuing to focus on that self care piece you were talking about earlier and also making progress on these areas of interest?
I still feel like I fail at these on like a very routine basis. I'll go on a vacation. I'll be like, okay, I have no responsibilities. I'm going to get up and run every morning, and I'm going to go do something for myself, and then think I'm going to do that. And then I come home and I work a 12-hour shift. And then I'm like, okay, let's go running. And it's raining out in Philadelphia. It's not always sunny in Philadelphia, like everyone says. So I'm not going to go run. And then, I have some project or someone's asked something of me that I've not been really good about saying no to. And I end up saying yes and doing that. And so, I think the idea that when I'm feeling good about the things when I'm taking care of myself, it's that I focused probably at the beginning of my day on the things I need to do for myself, and then saying no to the things that I don't have time for. And that is hard. It's really hard when I want to say yes to everyone. And then to say no and then walk away from things makes me feel like I'm going to miss something.
It feels like self-care is a never-ending journey, but then also when you're especially a person that's very curious and really wants to say yes and also really giving, saying no can be challenging in part because you feel like you're disappointing people, but also in part because you could be missing opportunities that would be really exciting for you. So that definitely resonates and is something that I've experienced a lot myself as well. Thinking about your day-to-day in terms of both the clinical domain, the research domain, and then the QA domain, what does your interaction with other healthcare professionals look like? Who are the people that you're interacting with, not by name, but by role and by structure in those domains?
I think of healthcare in this like very team environment. I was a firefighter before this, and there was no way physically to fight a fire by yourself. You had to have someone who operated the truck, and you couldn't pull the hose in by yourself because it was too heavy. And it's really dangerous to go fight a fire by yourself without someone to back you up in case you got injured. And so that job like required a lot of interactions for multiple tasks to be happening at the same time, and trust that other people were doing their job to make it safe. And I think healthcare is very similar, right? And I think that every person in the department that I work with is like has a really important role. And like from the person who greets the patient at the front desk and takes their name and information, like the people come into the ER on their worst days. And like that person can have an impact on how they feel. And especially when our ER wait time might be long, those people have a very big role in helping our patients feel like that we still care about them. And I think that like goes all the way through from the person at the front desk to the person who registers them to the techs who help us with IVs or lines or EKGs to the nursing staff who deals with almost everything in between and helps make clinical decisions for us, right? Then I've had many a times where a nurse has said something to me that I didn't realize, or told me some piece of information that the patient was willing to communicate to them, but not to me, that changed clinical management. And so those are people that I think that I rely on a daily basis. And this includes our physician colleagues, our PAs, our consultants that we talk to. I fortunately have the ability in my current job to be able to interact with so many different people and learn from all of them at the same time, I think that that's pretty amazing. For me, it's like realizing that everyone has a really valued part on the team and hoping that I express that to others so that they feel like what they're doing is important as well.
It's such a good point in a world of direct patient care, and especially in a really sensitive situation, which the ER almost always is. Every person on the team plays such an important role and can really make or break a patient's day in a way that has such big implications for both their outcomes, but also their actual experiences and their sense of self and their satisfaction. So that makes a ton of sense. You've mentioned your firefighting experience a couple of times, and you just mentioned the parallel in terms of the team based approach being really important in both of those contexts. I'm wondering if there are any other parallels that you've noticed comparing your work in firefighting to your work as an NP now.
The team environment is probably the biggest parallel between the two jobs and this act of service or giving back to others, right? And so I think that was part of the reason when I did to a transition, I wanted to make sure my job transition was to still be caring for others in their times of need. And so that was one of the reasons that I stayed in the healthcare field instead of like taking a job somewhere else, like becoming an engineer or something else like that. And not that they don't have important roles, right? I think that they just don't have direct patient care where they're helping people on some of their worst days. And that's something that brings me satisfaction.
Absolutely. And the human connection component of both of those jobs, where it's really person to person, that's pretty amazing. Given now you've had such a wide variety of clinical experience, we'd like to ask you some more questions that are kind of clinical tips focused so you can share your expertise with listeners. What tips do you have for advocating for patients' needs and preferences within the healthcare system?
That's like really a tough question, right? Because it's always easy to say that out loud when you don't have a clinical situation where you have to advocate. But when you have to make that decision to advocate for a patient, that can be really tough because you're like going against maybe what someone might recommend. Maybe it's a consultant in the ER that has a recommendation, and I have to like go past to that person to whoever else is on their team and have another conversation with them. Or I remember there was a patient I had a new diagnosis of cancer, and I was having difficulty getting them to be seen in one of our clinics. And it had to do with getting previous records was really what it came down to. We need previous records, but the patient's place had shut down, so we couldn't actually get the records. And so that was really tough. So I advocated on the behalf of the patient. It didn't feel good because the person on the other end wasn't happy with what happened. But at the end of the day, the patient got to the care that they needed, which it was what I was hoping for. So I didn't feel good about it. I felt good for the patient because I expected my family member to get as far as care, but it didn't feel good to like do that and have a conversation that was tough with some other providers in the health system that, made their days a little bit harder than what it would have been for them.
It sounds like sometimes there's some friction when you're advocating for patients because you're not necessarily always feeling like you're on the same side as the other providers. And that's tough as well because you have to be patient first, but you also have to keep in mind your peers and your clinical colleagues. We'd love to learn a bit more about your clinical expertise in the domain of ultrasounds. We know you have a lot of experience here. So, our first question for you is, do you have any tips for clinicians to decide when to actually use point of care ultrasounds? When should they consider those?
Oh gosh, I think it depends on the clinical scenario. In the emergency department, we have pretty clear guidelines for point of care ultrasound that have been evolved over the last 20 years that show evidence when an example would be free fluid in the abdomen for someone who has trauma and what's called a FAST or NEFAST exam. And so I think we know those clinical indications. And as point of care ultrasound has trickled down to some of the other specialties, critical care medicine, they have some indications as well with mostly heart and lung exams and fluid dynamics, as well as a FAF exam or free fluid down in the abdomen. And then in primary care medicine, that is starting to trickle down, and the physician colleagues have made it part of their residency program now. So it's a guideline that they've just recently had to adopt that into practice. And I think that that's where it is more difficult, is where does point of care ultrasound fit into some of these other specialties in the busy clinic and family practice? Where do you fit in the idea of, let me do a DVT study in the middle of clinic, which takes maybe 5 extra minutes or more. And how does that change my clinical management? I think that makes it more difficult. So I think in my world, it's really easy. I know the clinical cases where it's important and useful. And those are very varied in the ER because we have so many different types of scans, from someone who has a skin infection to determine whether that might be an abscess that we need to drain, to someone who has hypotension and we're looking for the cause of that low blood pressure and shock. And I think that just those guidelines are pretty easy. I think in the other areas, it's a little more challenging trying to figure out where that fits in.
Yeah, it's super interesting to hear how clear the guidelines are in the emergency medicine setting and maybe in the critical setting to some extent as well, but a lot more unclear in the outpatient setting, not just because the clinical guidelines are uncertain, but also because it's hard to figure out how to actually have it fit into a clinician's workflow in a difficult and very busy primary care setting. But it certainly seems like it has a lot of potential, like it's a much lower cost way to get various imaging done and much more portable. So hopefully it's something that will become more mainstream and also more universally understood across the board as time evolves. Given your experience with QA in particular, curious if you have any tips for actually performing ultrasounds and making sure that you get high quality results on the other side.
Oh gosh, practice and good people around you that help you when you have questions. I just think ultrasound is such a tough skill that is operator dependent. It is not like anything I've done where I felt like I was really good at the beginning. I felt like I was not good at the beginning of doing an ultrasound, a cardiac scan. I felt like, wow, I can't find the heart in the way that I want to, or replicate this different, and like peristernal long axis is one of the first views that we get. And I had trouble at the very beginning finding that window. For me, it just took a lot of practice, and I'm really fortunate to be around some of like what I would call some of the leaders in ultrasound in the country, and they've been willing to teach me and help me learn that, so that hopefully I can help others learn and practice that on their own. So for me, it's just like it's repetition over and over again, and then it's learning it from different resources. We have guidelines and books that can help, and videos. There's some online websites that have free access to medical education too.
It's so great that you're in a position where where you recognize the kinds of folks that you're learning from, and then you're excited to pass that knowledge on because it seems like it really is such a hands-on skill. And so folks who are excited about being educated in it is a very good thing.
The point of care ultrasound space is just that was part of the attraction, actually. I love the care that I give and the skill that I have that I've been able to then translate to better patient outcomes. But the community around point of care ultrasound is so open and welcoming. It was like a breath of fresh air that I can't. This community is just an amazing community. So I'm excited to see, because everyone in point of care like wants to see what that next step is. How do we train others? How does this go into the primary care space? I'm pretty excited. It's a really exciting place to be.
It sounds almost like a startup-y style environment of like really bringing something new to a variety of fields or parts of the medical field, and then being able to really be big decision makers in how that technology is going to get adopted.
I mean, like the people who started point of care ultrasound are still in practice, right? They're people we can still talk to today. It's like I'm looking over, I'm like, well, that person has done all of those studies, like made it so we could do this. And they like forged the path, because their path was not easy, right? Their path to do point of care ultrasound came with their own individual challenges that they've had. And to know that they've overcome those and worked through those, all in the name of like giving patients better outcomes and doing better for the patient, that's exciting.
100%. Also, so cool when you get to meet your educational heroes or folks where you're just like, oh, I look up to so much from a professional or personal perspective. And now I get to collaborate with you. That is so amazing.
Yeah, I was at a conference this last fall, and one of the books that I started on ultrasound was written by one of the physicians. Her name is Vicky Noble. And I got to meet her. I was like, do you know that you taught me the beginnings of ultrasound? And she didn't, she was in the, because of her book. And it was pretty amazing to just be able to like say hi to her and tell her thank you, and know that she's still in practice doing this today. That's pretty cool.
That is really, really, really cool. Maybe to bring some of this to life, I wonder if you could share a rewarding patient story from your experience using this technology.
I had a patient who became hypotensive and went into shock in the ER at the end of my shift. And I had already signed out clinical care of my patients to another provider. And I was in kind of the last 15 minutes of my shift and didn't have any clinical work. And no one had signed up for the patient. They had just gotten roomed. And so I followed in with an ultrasound machine. And within 20 minutes, we're able to have the OB team down, realize that the patient had an ectopic pregnancy, had ruptured that ectopic pregnancy, it was in a life-threatening condition, and get them to the OR. And so like within the time that they started to have their blood pressure become lower and go into shock to the time they made it into the ER was less than an hour, 45 minutes. To see the like clinical, be able to make that happen rapidly and to be able to recognize that at the bedside, just like it made me feel all of the training and all of the work that went through to make this happen, it was worth it because that one patient really benefited from it. And so those clinical days, those you call those clinical saves at the bedside, and when you can do it with a technology like ultrasound, it makes me feel it was worth all of the education, time, changing careers, all of those things.
That's such a powerful story and really speaks to the importance of early diagnostics and really timely intervention. It's really special that you were able to see that come to life relatively recently in such a powerful way. I can imagine lots of really interesting and exciting use cases for point of care ultrasounds in a primary care setting as well. But I'm curious, what are the things that you're most excited about, or any specific areas where you think it'll really make a huge difference?
It's interesting to see where the technology is going. And there's this AI piece that is coming into basically every aspect. I mean, AI is kind of talked about in every profession at this point. And I think it's a question that we don't have good answers to, but I'm curious to see where AI will take ultrasound. Does it help us gain images faster and more accurately? Does it help the user in training? Does it help us not miss things? I think that's where the question in the field is right now. How does AI technology impact point of care ultrasound? I don't think we know the answer. Just like in many other fields, right? We don't know where AI might change a job around so that that job looks different than it did prior to AI. And I think that's exciting. I like technology, but I think it's also scary for some people as well because it might, and I think people worry that does AI change a job so it's not available anymore? I don't think that's the case for us. I think it's probably something that will help us do our job better. I'm excited to see if that's a possibility. And maybe it's not. Maybe AI is not a solution for point of care ultrasound, or maybe it doesn't help us out in the medical field like we hope it to. But I think that's where we're going to see some changes in technology and some movement forward in the healthcare space.
Definitely. It seems very likely that AI will play a role in the healthcare landscape, but probably more so supplementing, augmenting, helping with training rather than replacing, just because so much of healthcare remains very human to human. And it's hard to imagine AI playing a really big role in that aspect of it, at least. So it's a good training tool and it probably will make
Yeah.
things better, but we'll always really rely on humans for the heart and core of healthcare.
Yeah. And I think, like, to be honest, like, I think I actually make a bigger impact on my patients' emotional well being than I might actually think I probably do on the diagnosis and treatment side. Just like being at the bedside and letting someone know that we care about them, I think that actually does a lot more for the patient than what we probably give ourselves credit for in the healthcare space.
From the patient perspective, that deeply resonates in the sense that if I think about the amazing experiences and not so amazing experiences that I've had in the healthcare system, it's always as a function of the humans on the other side and how they treated me, how considerate they were. It's really the emotional aspect that I think makes or breaks someone's experience. To close, we'll ask you the same two questions that we ask all of our guests. One is more of a reflection on the healthcare system, and then one is just a broader advice question. So, in terms of the healthcare system as a whole, what changes would you like to see to really improve patient care?
I would dream of a day where our healthcare system has capacity and functionality to treat everyone, regardless of how much they make, their income levels, their ability to have insurance. And I think it's a really tough space because of the way that our healthcare system is set up. So I dream of the day that everyone has equal access to care and is able to get the care that I would be able to get for myself, for everyone else. I think everyone in healthcare wants that, but we haven't obviously found the answer to that question. And how do we do that without giving up the amazing things we do on the pioneering front where we change medicine, like the COVID vaccine that saved countless number of lives? That was done because of the ability to research that and put funding into that. And so I don't know what the answer is. How do you keep both of those things going at the same time? I don't know, but that's where I would love to see healthcare go, is to be able to give equal access to amazing care to everyone.
It's a really astute observation of everyone to have access, and that is so critically important. And at the same time, so many of the leaps and bounds that are made are on these like edges of discovery, and they do maybe feel like they're intention from a resource perspective, but 100% agree that in an ideal world they can exist together. And it should just be a no-brainer that patients can get the care that they need regardless of their situation. So,
It really makes me sad that in itself can bankrupt people, and that we're in a society where a significant portion of people go into bankruptcy because of healthcare expenses, and that's hard for me to like stomach at times, knowing that I'm on the other end of that. My salary comes from treating and helping others. It would be really nice if we found a way to get away from that type of model.
And it's also a challenge because it feels like clinicians are still not compensated as much as they should be in many cases as well. So it's like, yes, healthcare is super expensive, but where are those dollars flowing? And for the most part, they're not actually flowing to the people that are delivering the care. It's a difficult system and certainly broken in many ways, and a lot of things to resolve before we can have true access, but also hold on to that innovation.
But then I think to myself, like, would I want to get care anywhere else in the world? If I had some very serious illness and I became ill, I would go to my hospital because I feel like they give really good care, right? So as much as I think I can be the devil's advocate and say I wish things were different, it's also I don't know if there's another place that has it better than what we have it either. I mean, despite we have definitely many limitations to it. So
I think that's absolutely right. I did a lot of research on other healthcare systems to see has some countries solved this, and the answer is basically no. Like even countries that have universal healthcare systems, there's a lot of value that comes from that, and there is some level of access. But in many ways, many of those countries actually have even more disparate systems for the haves and the have-nots. So certainly, there's no single model that we can really look to for what really excellent healthcare looks like, and that's yet to be invented.
yeah, maybe you two are the ones that are going to change our healthcare system in ways that we've not been able to yet. That would be amazing.
only if we're working with people like you. So, maybe to wrap up, what is some advice that you want everyone to hear to walk away with? And this advice can be clinical or non clinical.
It's like during those tough days, because I think every clinician has a very tough day, and for some clinicians, some providers, that those days are more frequent than not. And I think it's like remembering why you came into this field to start with. And I would imagine for the most people, because you've had an experience and want to be able to help and care for others because of what experience that you've had, I think remembering that can help. At least it does for me. It allows me to level myself to say, okay, yeah, this was a really tough day. It emotionally took it out of me dealing with patients that were either upset with me because of maybe a wait time or delivering really bad news. That's tough emotionally to do. But at the end of the day, I think to myself, if I can think like I came into this because I wanted to be that person that can make a difference to someone at their very toughest moments or in their health, and that makes me feel like, or at least helps level me. So I think that would be my advice, is like, just remember when you started this whole process, despite all the things, the bureaucracy or the things that are like really bad about the job, at the end of the day, you're still being able to care for others. And I don't think a lot of professions can say that about what they do, where they feel like they make a difference on a daily basis. And I would imagine that every healthcare provider, if they look at it, they're probably making an impact on someone's life every single day.
That's really nice advice. I'm sure that there are certain elements that make it easier for you to keep that mentality in mind, given your interactions with the next generation of clinicians as well, and the fact that you're educating too. When we talk to clinicians that are just graduating school and just beginning their clinical practice, they very much have that mentality. And it seems like sometimes throughout the ups and downs of the clinical career, it becomes easy to lose sight of that. It's a really, really hard job in so many ways. So it's really nice to hear that you've been able to hold on to that and make that so core to who you are and how you operate.
It's really nice to like, thanks for taking time to talk with me. It's exciting to see what you guys are doing. And yeah, I really appreciate it.
Thank you so much. It has been a really wonderful conversation.